These two arrows are pointing to two red spots, and those are actually abscesses that are healing up right now. That's where you have this cavity here that has gone into the tooth, all the way up into the nerve, and way in there is that infection that this child has in their tooth. Look at this tooth, compare these two. The size of the tooth, look how big this tooth is. And you know, it's already breaking down. Well, this one was that big, but it's all of this is broken down. Look at this one. This kid was actually 5 or 6 years old. I actually saw this kid last week. Lucky was, this was the only cavity that the child had, but this is a back molar. This is what I call the two-year molars. These don't come out till the child's about 12 years old. And this cavity, I don't know if you can see it, but the gum is almost overgrowing over that cavity, and pretty much half that tooth, and you see a gray layer around all of this. So, and the permanent molar isn't even there yet, and these are the teeth that are very tricky teeth, and these are the teeth we do everything I can to save them. Even if a parent says, can you just pull this tooth, I try to convince them to save this tooth, because I know how important it is for that tooth to be there. So this is what we did. We put a cap, sorry about the pictures, it's a little fuzzy, but we put a full cap around that tooth, and at least we were able to protect that tooth and hope that it's going to have that tooth for a long time. Baby molars do not fall out till 10 to 12 years of age. Need to be treated ASAP to avoid pain, infection, swelling, and other negative consequences. So we've been talking about why we fix these teeth, and I mean, I'm showing you all these pictures, not because I made this up, but because this is what I see every day in my office, and I want you all to be aware of it. And I hear every day that, oh, it's just a baby tooth, why fix it? Because these teeth have to be in your child's mouth 10 to 12 years of age. And if they were delayed in eruption, then you're looking at 13, 14. So it's something to really take care of and pay attention to. This is my scare tactic slide. If all else fails, here are pictures. Here's a kiddo. Infections all the way near into his eyes, and you can see how it's all swollen and all of this. You can compare his cheeks from this side to this side. See how it's all red, and he probably, my guess is, I mean, I got this picture from the American Academy of Pediatric Dentistry website, and for an infection, this kiddo most likely has a fever and most likely needed to be taken, same thing with her too, same right here, most likely needed to be taken to the emergency room and started an IV antibiotic. If I saw this in my office, I am sending that child to the emergency room for an IV antibiotic. Because if the infection's right here, I mean, pretty soon there's a little bone there, and then the brain is right up there. So I think 2 years ago in New York, a 12-year-old boy died of an infection because this infection went into his brain. So these are pretty significant. If the infection goes down, I mean, these are the top. I didn't have any pictures of the bottom, the actual bottom jaw swollen. Say if this wasn't like this, but if the bottom jaw gets swollen, here's the neck, and that's where we breathe through, and that infection, if it gets swollen and everything gets bigger, it's going to close the air pipe through which we breathe, and then it becomes something that's actually life-threatening, all because of a cavity that wasn't treated. This could happen where you've got the cavity. I think a dentist is trying to work on this. They put some temporary filling on top of it, but you've got two gumballs or pimples or whatever you want to call these. We call them abscesses, where there's pus all the way inside there, and that's pretty much what you see in children. Good oral home care, we're almost getting to the end. Your parents should get in the habit of wiping their gums, baby's gums, with damp washcloth after feedings. After the teeth come in, brush. It's pretty simple. So we're going to talk a little bit about fluoride actually. There's no such thing as too much fluoride. There is such a thing as too much fluoride. Use a non-fluoride toothpaste on your baby. You get toothpaste without fluoride, so we'll talk a little bit about that. Go ahead. And we have fluoride slides here. This is probably the best thing I could tell you. Set a good example. Children model their parents very closely. I think parents don't realize the effect they have on their child and their child's behavior by what you say, by how you behave, by how you interact with others. I mean, parents are in a very, very significant area of affecting their child's behavior, and that's also for dental health. If your child sees you taking care of your teeth religiously, brushing, flossing, doing things like that, they are going to want to do it too. If your child sees you going to the dentist every 6 months, they're going to be like, oh, Mom does it, I'm going to do it. So parents are the example. So, okay. We talked about this floss. Even if your child has spaces between their teeth, even as a baby, go ahead and floss their teeth if you can, just so you'll build a good habit for them. Fluoride toothpaste in young children. So you've got toothpaste, you've got the training toothpaste, safe to swallow, fluoride free. It's good because there is such a thing. If you have too much fluoride, it can do damage to teeth. So young children will swallow large amounts of toothpaste. When you brush a baby's teeth, they're just going to swallow everything. So you want to watch how much fluoride is going into their mouth. Okay. So that's why you have these training toothpaste, so they can, as they watch you spit, then they learn how to spit the toothpaste out also, and once they can spit, go ahead. You can use a pea-size amount, like really tiny amount of fluoride toothpaste after they learn to spit, because even after they learn to spit, they still end up swallowing a little bit, so want to use just a little bit. Really, you don't have to put toothpaste from here to here. Just a little bit is good. Replace toothbrush heads. Toothbrushes, they work, but if you have the head, going all over here flailing, then this toothbrush is not going to do its job as this toothbrush will, because all the bristles are going to go right into the gum line. So this is a child's toothbrush. The difference for a child versus an adult, because their teeth are smaller, you got a smaller head. An adult toothbrush has a little bit of a bigger head. So, because the teeth are bigger, so you get more room. You want to use a smaller head and a soft bristles toothbrush on your children, and for yourselves, a little bit larger head and still a soft bristle. Children under age 6 need help brushing. I will say kids these days are very, very, very smart. You get these 3-year-olds, 4-year-olds asking you all these questions, and you're like, well, where did that come from? But there is a certain amount of development that needs to happen as far as motor activity goes for them to be able to brush adequately. So this is my rule of thumb. I don't know where I learned this from, I think the psychologist, but when a child can write in cursive, it shows fine motor ability. The same fine motor ability needed for brushing. So while your child might be really intelligent and talking about all kinds of stuff, and you're like, wow, my child's really smart, they're brushing by themselves. Well, just like there's stages, you got your baby, and then they're crawling, and then they're toddlers, and they're barely walking, falling, and then they're learning to walk. Those things, they're milestones for children through their growth and development. And one of the milestones is developing what's called fine motor, where they can move their finger really slowly like this, just barely. Because if you have a child write, they're just going to do this because they move the whole hand, but they can't just move a little bit like that. And that fine motor ability comes with writing in cursive. So until they can do that, you want to make sure that you're brushing for them, because they're not able to just barely put that brush in and rotate in small circles, because they're going to want to do this, and that's not really going to get everything. Again, flossing should be routine by the time teeth touch.